Good evening, ladies and gentlemen. My name is Dr. Paul Zong, and I am truly grateful for your presence today. As we all are aware, cancer continues to be a daunting adversary in the field of medicine, and remains a significant cause of fear and anxiety for many. As a medical oncologist, I have had the privilege of treating numerous patients, each unique in their battles against cancer. Throughout these interactions, one thing remains constant: the question that often lingers in their minds, after they have been introduced to the conventional treatment modalities, such as chemotherapy, targeted therapy, or immunotherapy. This question is, "Doctor, what else can I do to get a better outcome?" Their queries extend beyond the realm of what we've termed standard care. They delve into the sphere of alternative practices, dietary changes, the use of natural supplements, in essence, anything that may tip the scale in their favor in this battle for life. These questions are reflections of their hope, their will to fight, and their yearning for a positive outcome. So how should we, as medical practitioners, respond when faced with these queries? Do we dismiss them, and proclaim that nothing else can be done beyond standard care? Or do we explore, educate, and guide our patients through these uncharted territories, keeping their safety and well-being as our compass? In today's talk, I am eager to share with you my perspective on this crucial matter. Drawing from the wisdom of the father of medicine, Hippocrates, we will reevaluate our roles as oncologists in the holistic journey of a patient with cancer. I hope to engage you in a meaningful conversation about integrating Hippocrates' principle of to help, or at least to do no harm, in our modern practice, and how this philosophy could shape our approach to integrative cancer care. Let's embark on this journey together. The quote by Hippocrates, "As to diseases, make a habit of two things, to help, or at least to do no harm," carries profound significance in the field of medicine. While the principle of do no harm is commonly emphasized and followed, Hippocrates reminds us that the primary focus should be on providing assistance and aid to those in need. By highlighting the importance of helping, Hippocrates emphasizes that healthcare professionals should actively seek opportunities to make a positive impact on the well-being of their patients. Merely refraining from causing harm is not enough. They should strive to offer genuine assistance and support in combating diseases and improving overall health. Furthermore, Hippocrates acknowledges the interconnectedness of three essential factors in the medical field: the disease, the patient, and the physician. This recognition reflects the holistic approach to healthcare that emphasizes the multifaceted nature of healing. The physician is positioned as a servant of the art, indicating a sense of duty and responsibility to provide the best possible care for the patient. In this context, the patient's active participation and cooperation become crucial. Hippocrates emphasizes the importance of a collaborative relationship between the patient and the physician. Both parties must work together to combat the disease effectively. This underscores the significance of open communication, trust, and shared decision-making between healthcare professionals and patients. Ultimately, Hippocrates' quote serves as a reminder that the fundamental goal of medicine is to provide help and support, going beyond the mere absence of harm. It calls upon healthcare professionals to approach their practice with compassion, empathy, and a commitment to making a positive difference in the lives of those they serve. The ethos of healthcare, as suggested by the Hippocrates quote, demands that medical practitioners not only refrain from causing harm but also actively pursue paths to help their patients. This principle, when applied to cancer treatment, calls for the consideration of all possible avenues to aid the patient, even when it requires going beyond the so-called standard care. While the core standard care, including chemotherapy, targeted therapy, and immunotherapy, has made significant strides in combating cancer, the harsh reality remains that most types of cancer are still incurable, and patient outcomes can be suboptimal. The growing body of scientific research and clinical data are revealing a range of complementary and alternative therapies that may provide benefits to patients, even if they haven't yet been incorporated into standard care. This includes advising on beneficial supplements, carefully administering off-label medicines, using hyperthermia therapy, and offering high-dose vitamin C infusions. The use of dietary supplements, for example, has been shown to help manage some cancer-related symptoms and side effects of treatments, thereby improving the patient's quality of life. Off-label medicines, those used in a manner not specified in the FDA's approved packaging label, may have the potential in treating certain types of cancer based on emerging research. Hyperthermia therapy, which involves heating the body or a part of it to increase the effectiveness of other cancer treatments, has also shown promise. Moreover, high-dose vitamin C infusions have been the subject of multiple studies, some of which indicate a potential role in cancer treatment, especially when used in combination with other therapies. It's crucial to note that such complementary and alternative treatments should be based on robust scientific research and clinical data, and they should be administered with the utmost care to ensure the patient's safety and well-being. They are not intended to replace standard care, but to enhance it, offering new possibilities for improving patient outcomes. Now you can see, the philosophy of Hippocrates compels healthcare providers to explore every potential avenue of care for their patients. In the context of cancer treatment, this means not only implementing standard care but also considering the use of evidence-based complementary therapies. It involves creating a personalized treatment plan that maximizes the patient's chances of survival, manages symptoms, and improves their quality of life, truly embodying the principle of to help, or at least to do no harm. Indeed, King Charles' words resonate strongly within the medical field: nature is our best teacher. This wisdom holds profound relevance to cancer research. The natural world has given us many of the tools we use today in our fight against cancer. Let us approach each challenge with the knowledge that nature provides us, working towards more effective and less toxic options. In closing, I want to express my gratitude to each of you for taking the time to listen and engage in this critical conversation about the future of cancer care. I hope our discussion has sparked new thoughts, ideas, and, most importantly, hope. As we part ways today, let's carry forward the spirit of this dialogue, the wisdom of Hippocrates, and the teachings of natural medicine into our practice, our research, and our quest for a world free of cancer. Thank you all, and goodbye. I want to dedicate my work to two mentors who have sadly passed away. One of them is Dr. Bernard Ferjit, who was a highly respected figure in American hematology. He held the position of Professor of Medicine, and was the director of the training program at Yale School of Medicine. Dr. Ferjit was not only well known as a skilled clinician, scientist, and teacher, but he also taught me valuable lessons on how to ask important medical questions, and approach each patient with compassion. His influence has had a profound impact on me, and countless other students around the world. I will always remember and honor Dr. Ferjit for his contributions to the field of medicine. Dr. Ferjit's legacy will be cherished and remembered by many in the field of hematology and oncology. Dr. Joseph Michaeli was my mentor during my time at MSKCC, Memorial Sloan Kettering Cancer Center. He held the position of Associate Professor of Medicine and served as the Chief of the Multiple Myeloma Service in the Division of Hematology/Oncology. Additionally, he was the Director of Translational Research for Weill Cornell Center of Excellence for Lymphoma and Myeloma. Dr. Michaeli was a highly respected clinician and researcher who made significant contributions to the field of multiple myeloma research and treatment. Under his guidance, I learned how to think creatively and approach challenging topics such as cancer stem cell research and epigenetic therapy. He emphasized the importance of hard work and dedication in our endeavors. The impact of his teachings and mentorship will be deeply ingrained in my memory.